Stay away from this blood clot disease. Welcome to the channel 70 Lasting Health. Do you believe that the vegetables we eat every day, which seem to be healthy, can be the silent enemy that increases the risk of stroke and blood clot disease? Especially in the elderly? This is not a rumor, this is a scientific fact that 99% of seniors do not know. Are you unknowingly ingesting substances that thicken your blood and form dangerous blood clots? In today's video, we will show you which vegetables should you avoid if you have blood clotting problems or are taking blood thinners, why they are dangerous for the elderly, and safe eating solutions to protect your brain and heart. Don't miss any moment. Watch now to protect yourself and your loved ones. Spinach, king of green vegetables and important health note. Spinach, also known as spinach or spinach, has long been known as a treasure trove of nutrients. With its eye-catching dark green color and pleasant flavor, it is a familiar ingredient in many dishes, from salads, smoothies to stir-fries and soups. Amazing health benefits of spinach. Spinach provides a large amount of vitamins, minerals and powerful antioxidants, providing many benefits to the body. Protects eyes and eyes, rich in beta-carotene and vitamin A, which helps prevent vitamin A deficiency, dry eyes and vision problems. Supports strong bones, contains vitamin K, calcium, magnesium, and manganese, important micronutrients that help increase bone density and reduce the risk of osteoporosis. Blood sugar control, contains alpha-lipoic acid and antioxidants that help reduce glucose levels and increase insulin sensitivity, which is beneficial for people with diabetes. Cancer prevention, chlorophyllin, folate, and flavonoid compounds in spinach have anti-inflammatory and antioxidant properties, helping to reduce the risk of certain cancers such as prostate, lung and liver cancer, and hence digestive system. The abundant fiber and high water content help prevent constipation and maintain a healthy digestive system. Good for the heart, contains nitrates, magnesium, potassium, and folate, which help dilate blood vessels, improve circulation, lower blood pressure, and protect heart health. Potential harmful effects of eating too much or the wrong way. Although very nutritious, spinach still has some potential risks if not consumed properly, especially for the following groups of people. Kidney stone risk. Spinach contains high levels of oxalic acid, oxalate. Oxalate can combine with calcium to form calcium oxalate stones, which are especially dangerous for people with poor kidney function or a history of kidney stones. Tips: blanch or boil the vegetables before eating to reduce oxalate levels. Digestive disorders. High levels of fiber, especially insoluble fiber and magnesium, can cause gas, bloating, abdominal pain, or diarrhea if consumed in excess. Reduced calcium absorption. Excess oxalate can interfere with calcium absorption in the small intestine, leading to a risk of calcium deficiency in the body. Anticoagulant drug interactions. Vitamin K in spinach plays a role in promoting blood clotting if you are taking blood thinners such as warfarin. Consuming too much spinach may reduce the effectiveness of the drug. Tips: maintain a stable intake and consult your doctor to adjust the appropriate dosage. Suggestions for delicious spinach dishes. To maximize the benefits of spinach, prioritize cooking methods that reduce oxalate and are easy to absorb. Stir-fried spinach with garlic, a simple, delicious dish. You should blanch the vegetables in boiling water before stir-frying. Spinach soup. Combine with potatoes, minced meat, or dried shrimp for a refreshing, nutritious bowl of soup, preferably cooked. Avoid eating raw. Spinach smoothie. Blend spinach with banana, milk, or honey for a nutritious and easy-to-drink smoothie. Korean salad. Mix blanched spinach, toss with sesame oil, garlic, soy sauce, and roasted sesame. Spinach is truly a valuable source of nutrition. Eat moderately, balance, and always listen to your body to have the healthiest diet. Spinach is a very nutritious food, but due to its high content of certain substances such as oxalate and vitamin K, some groups of people should limit or be careful when consuming it, especially in large quantities or raw. Below are people who are recommended to limit their consumption of spinach. 1. People with kidney disease, kidney stones, weak kidneys. Reason: spinach contains very high levels of oxalic acid, oxalate. Oxalate easily combines with calcium to form calcium oxalate stones. The most common type of kidney stones. Recommendation: people with a history of kidney stones or poor kidney function should limit their intake, not eat too much, and absolutely should not eat raw. Blanching the vegetables in boiling water and discarding the water will significantly reduce the amount of oxalate. Spinach also contains potassium, which can cause potassium accumulation if kidney function is impaired. 2. People with gut reason. Young spinach leaves have a relatively high purine content. When purine is metabolized in the body, it will form uric acid, which can increase uric acid levels in the blood and promote gout flare-ups or worsen the condition. Recommendation: be careful and limit the consumption of spinach, especially when the disease is in the acute stage. 3. People taking anticoagulants. Spinach is rich in vitamin K, a vitamin that plays an important role in blood clotting. Consuming too much spinach can reduce the effectiveness of anticoagulants such as warfarin. People taking this medication should keep their vitamin K intake stable and consult their doctor to adjust the dosage to suit their diet. 4. People with diarrhea or irritable bowel syndrome. IBS reason: spinach is high in insoluble fiber and magnesium, which has a laxative effect. Recommendation: eating too much can cause gas, bloating, abdominal pain, or diarrhea, especially for people with sensitive digestive systems. 5. Children under 4 months old. Reason: spinach has a relatively high nitrate content. For infants, the body cannot process nitrate well, which can cause blood disorders. Methemoglobinemia syndrome. Points to note: absolutely should not be given to children under 4 months old. 6. People who have just had surgery because it affects the ability to clot blood. Vitamin K and can cause fluctuations in blood sugar. Spinach should be avoided for 2 to 3 weeks after surgery to allow the body to recover stably. If you belong to one of the above groups, you do not necessarily have to absolutely abstain unless directed by a doctor, but you should limit the quantity, frequency, and always prioritize cooking. Blanch, boil to remove water to minimize risks. Broccoli, a superfood for cell and heart health. Broccoli, also known as cauliflower, is a cruciferous vegetable brassicacean known for its outstanding nutritional content and powerful disease-fighting abilities, with its tiny green-shaped and sweet, crunchy flavor. Broccoli is an indispensable ingredient in a healthy diet. Nutritional highlights: broccoli is a rich source of vitamins, minerals, and bioactive compounds. Vitamin C provides nearly 100% of the daily requirement in just one small serving, about 78 grams cooked, helping to boost the immune system. Vitamin K, important for blood clotting and maintaining healthy bone density. Folate, vitamin B9, essential for new cell formation, especially important for pregnant women. Antioxidants, especially sulforaphane converted from glucoraphanin, lutein, and zeaxanthin. Minerals, potassium helps maintain blood pressure, calcium, and magnesium. Top 10 health benefits. 1. Powerful anti-cancer. The glucosinolate and sulforaphane compounds in broccoli have the ability to activate cell-protecting enzymes, kill cancer stem cells, and prevent DNA damage. This helps reduce the risk of cancer such as breast, prostate, stomach, and bladder. 2. Supports heart health. Soluble fiber helps lower LDL bad cholesterol. Antioxidants and potassium help reduce inflammation, prevent atherosclerosis, and regulate blood pressure. 3. Controls blood sugar. Rich in fiber and contains sulforaphane, which helps improve insulin sensitivity and control blood sugar, especially beneficial for people with diabetes. 4. Enhanced digestive function. High fiber content promotes healthy bowel movements, reduces constipation, and supports the growth of beneficial bacteria in the intestines. 5. Protect bones and joints. Vitamin K, calcium, and magnesium help strengthen bones. Sulforaphane compound has been studied for its ability to block enzymes that destroy cartilage and cause joint degeneration. 6. Improve brain function. Antioxidants and vitamin K can help boost brain function and improve memory, fighting cognitive decline. 7. Reduce inflammation and allergies. Biocompounds such as camphorol and omega-3, a form of fatty acid, have anti-inflammatory effects and reduce the effects of allergens. 8. Strengthens the immune system. High levels of vitamin C are key to keeping the immune system functioning properly. 9. Protects skin from UV rays. Sulforaphane acts as a natural shield, helping to protect the skin from sun damage. 10. Supports a healthy pregnancy. Folic acid folate is an essential nutrient that ensures healthy development of the fetal nervous system. Precautions when using broccoli. Interaction with blood-thinning medications. Broccoli contains vitamin K if you are taking anticoagulant medication, e.g. warfarin. Maintain a steady intake and consult your doctor to avoid reducing the effectiveness of the medication. Digestive problems. Eating too much broccoli at one time can cause gas, bloating, or stomach pain due to its high fiber content. Preparation. Steaming or boiling for minutes is the best way to preserve vitamin C and enhance the formation of sulforaphane. Broccoli deserves to be a hero on every family's plate. Broccoli is a very safe and nutritious vegetable for most people. However, due to the presence of certain compounds, there are a few groups of people who should limit or be cautious when consuming broccoli, especially in large quantities or using it regularly. Here are the people who should be careful when using broccoli. 1. People taking anticoagulants. Reason: broccoli is a rich source of vitamin K. Vitamin K plays an essential role in blood clotting. For people who are taking blood-thinning medication such as warfarin, consuming large amounts or suddenly changing the amount of broccoli can reduce the effectiveness of the medication, making it difficult to control blood clotting. Things to note: keep your vitamin K intake stable, and consult your doctor for advice on a diet appropriate to your medication dosage. 2. People with digestive disorders. Easily bloated. Bloated broccoli is high in fiber and belongs to the cruciferous vegetable group. Cruciferous vegetables contain raffinose and glucosinolates, which can cause indigestion, gas and bloating in some sensitive people. Note: if you have a sensitive digestive system, eat broccoli in moderation. Properly cooked, such as steamed or boiled, is easier to digest than raw. 3. People with thyroid disease taking medication like other cruciferous vegetables. Cabbage, kale. Broccoli contains substances called goitrogens or thiocyanates. These substances can interfere with iodine absorption and inhibit thyroid function. Note: for people with normal thyroid function, eating broccoli in moderation is safe. However, people with hypothyroidism or taking thyroid medication should limit raw consumption and not consume too much to avoid affecting iodine absorption. Steaming or boiling broccoli can significantly reduce the goitrogen content. 4. People with allergies. Some people may be allergic to cruciferous vegetables, leading to symptoms such as itching, rashes, or swelling. Note: if you have a history of allergies to similar vegetables, be cautious when consuming broccoli. In short, most warnings for broccoli are related to overeating or eating it raw. For people with underlying health conditions, if you have any health concerns, always consult your doctor or nutritionist. Romaine lettuce. Romaine lettuce is a popular lettuce known for its long, dark green leaves, crisp texture, and more intense flavor than other lettuce. It is the main ingredient in the famous Caesar salad. Romaine is highly valued for its nutritional content compared to many other lighter-colored lettuce. Key nutritional facts: romaine lettuce is rich in important vitamins and minerals while being very low in calories. Ingredients: outstanding feature resvitamin and beta-carotene, very abundant, good for eyesight, skin and antioxidant support. Vitamin K, essential for blood clotting and bone health. Vitamin C, a powerful antioxidant, helps strengthen the immune system. Folate. Vitamin B9, important for cell formation, especially beneficial for pregnant women. Fiber helps digestion and weight loss. Potassium helps regulate heart rate and blood pressure. Calories: very low, about 15 calories, 100 grams. The amazing benefits of romaine lettuce: good for the cardiovascular system, rich in folate, folic acid, which helps the body convert homocysteine. High homocysteine levels can damage blood vessels and lead to cardiovascular problems and stroke. Vitamin C and beta-carotene help lower blood pressure and prevent plaque buildup. Weight loss and digestion support. Low calories, high water and fiber content help create a feeling of fullness for a long time, reducing cravings at night. Fiber promotes intestinal motility, effectively preventing constipation. Sleep aid. Romaine lettuce contains niacin, vitamin B3, which helps in the synthesis of serotonin, an important hormone in regulating sleep. Eating romaine lettuce can help you sleep easier and deeper. Protects eyesight and prevents cancer. Romaine is a rich source of beta-carotene, lutein, and zeaxanthin, which act as powerful antioxidants, protecting the retina from UV rays and helping to prevent macular degeneration. Flavonoids and antioxidants help protect cells from free radical attack, reducing the risk of some cancers such as lung and nasopharyngeal cancer. Strengthen bone and nerve health. Vitamin K helps increase bone density and protect neurons from damage, helping to prevent neurodegenerative diseases such as Alzheimer's. Notes: when using romaine lettuce, food safety is most important. Since romaine lettuce is often eaten raw, the risk of bacterial contamination, such as E. coli, if not washed properly, is high. Always wash the lettuce thoroughly under running water or soak it in a specialized vegetable washing solution before eating. Interaction with anticoagulants. Similar to broccoli, due to its vitamin K content, people taking anticoagulants should be careful to keep their vitamin K intake stable. Storage. Lettuce should be stored in the refrigerator. Dry. Avoid storing with fruits that produce ethylene gas such as apples, bananas, because it can cause vegetables to spoil quickly. In short, romaine lettuce is a great food, but special attention should be paid to hygiene. Raw carrots, the golden superfood for eyes and health. Carrots, Daucus carota, are one of the most widely consumed vegetables in the world. Although they can be eaten cooked or raw, many people choose to eat carrots raw to enjoy the crunch and full natural flavor. Nutritional value of raw carrots. Carrots, especially when eaten raw, are an excellent source of the following nutrients. Beta-carotene, a precursor to vitamin A. This is the compound that gives carrots their distinctive orange color and is known for its ability to aid vision. Fiber, provides both soluble, lowers cholesterol, and insoluble, improves digestion. Fiber. Vitamin K1, important for blood clotting and bone health. Potassium, helps control blood pressure. Antioxidants, especially carotenoids, which help fight free radicals. Benefits of eating raw carrots. Eating raw carrots has many significant health benefits. Improve eyesight thanks to beta-carotene. Beta-carotene is converted by the body into vitamin A, an essential nutrient that helps protect the eyes from macular degeneration and cataracts. Eating raw helps retain the maximum amount of this vitamin, aids digestion and weight loss. High fiber content helps increase feelings of fullness, reduces calorie intake, which is beneficial for weight control and loss. Fiber also promotes bowel movements, preventing constipation if you drink enough water, reduce cholesterol levels. Soluble fiber in carrots binds to cholesterol in the digestive tract, preventing its absorption into the blood, thereby helping to reduce LDL bad cholesterol and improve heart health. Boost immunity and skin health. Vitamin C and antioxidants help boost the immune system, fighting off disease. Beta-carotene and vitamin C support collagen production, which helps keep skin healthy and fight free radical damage. Improve oral hygiene. Chewing raw carrots, which are firm and crunchy, acts as a natural toothbrush, stimulating saliva production, which helps wash away food particles and plaque, reducing the risk of tooth decay. Important notes when eating raw carrots. Although raw carrots are very good, overconsumption can cause some problems. Risk of yellow skin, carotenemia. If you eat too many carrots and over a long period of time, usually more than 300 grams or 0.5 liters of juice per day, your body may not be able to metabolize all the beta-carotene. This substance accumulates under the skin, causing jaundice usually seen on the palms, soles, and nose. This is a benign phenomenon and will disappear when you reduce your carrot consumption. Risk of vitamin A toxicity. This condition is common rare. Beta-carotene is a precursor and is not as toxic as synthetic vitamin A. However, eating too much, especially in concentrated form, such as juice, can indirectly lead to excess vitamin A, affecting the liver and bones, especially in young children and pregnant women. Risk of fetal malformations. Constipation, intestinal obstruction. If lack of water, carrots are rich in insoluble fiber. If you eat too much fiber without drinking enough water, the fiber can cause blockage in the intestines, leading to severe constipation or intestinal obstruction. Effects on ovulation. Women. Some studies suggest that women who consume large amounts of raw carrots or juice every day for a long time may affect ovulation, leading to irregular or absent menstruation. Recommended dosage. To maximize the benefits without side effects, experts often recommend that adults should only eat about 100 grams of raw carrots, about 1 to 2 small carrots per day, and should only eat 3 to 4 times per week. In short, raw carrots are a healthy and nutritious snack. Just remember to eat them in moderation and always wash them before use. Raw carrots are a great ingredient for both salads and snacks, being both crunchy and delicious, while retaining all the nutrients, especially vitamin C and some beta-carotene. Here are some simple yet delicious recipes for salads and snacks from raw carrots. RAW carrot salad. 1. Carrot and shrimp. Chicken salad Vietnamese style. This traditional Vietnamese salad balances the sour, spicy, salty, sweet flavors and crunchiness of raw carrots. Main ingredients: carrots, 1 to 2, shredded. Boiled shrimp or boiled chicken, boiled pork belly, shredded or shredded. Onion, 1/4, thinly sliced, soaked in ice water to reduce the pungency. Aromatics: basil, cilantro, chopped. Roasted peanuts, crush roughly. Salad dressing: sweet and sour fish sauce. Fish sauce plus sugar plus lemon juice or vinegar plus water, balanced ratio. Minced garlic and chili. Directions: put carrots, shrimp, meat, and onions in a large bowl. Sprinkle the mixed dressing over and mix gently to let the ingredients absorb the flavor. Let it sit for 5 to 10 minutes until the carrots are slightly soft before eating. Add herbs and roasted peanuts. Mix quickly and arrange on a plate. 2. French carrot salad. Clots is a simple, refreshing and very healthy salad, focusing only on the flavor of carrots and fresh dressing. Main ingredients: carrots, 2. Thinly sliced. Cilantro or parsley, chopped. Lemon vinaigrette, 2 tablespoons extra virgin olive oil. 1 tablespoon fresh lemon juice. 1/2 teaspoon Dijon mustard, optional. Pinch of salt and ground black pepper. How to make: mix all the sauce ingredients, add shredded carrots and chopped cilantro to the bowl. Drizzle with sauce. Mix well and leave in the fridge for about 10 minutes to let the carrots absorb the flavor and become crisper. Raw carrot snacks and side eats. 3. Healthy snack with carrots. This is a high-fiber snack that will keep you full for a long time and is very easy to make. Ingredients: carrots, 2. Peeled and cut into bite-sized pieces. Dipped. Greek yogurt dip. Greek yogurt mixed with a little minced garlic, lemon, salt and dill. Fresh cheese dip. Cream cheese or fresh cheese mixed with a little seasoning. How to make: prepare the dip to your liking. Place the carrot sticks and the sauce on a plate. Dip and enjoy. 4. Sweet and sour pickled carrot side dish. This dish is often served with fried dishes, bread, or as a pickle for vermicelli. Ingredients: carrot, 1. Shredded or thinly sliced. White radish optional. To increase crispiness, 1 small. Shredded. Water, 1 cup. Sugar, 3 to 4 tablespoons. Vinegar or lemon juice, 2 to 3 tablespoons. Salt, 1/2 teaspoon. Catch lamb, schul. Trun kort de cc siv jai matchut muiva ggiang. Zak, d kong 15 futri reka circ. D rout, juploi babc d mui hang valam raujan hen, fan we si engam. On sayan we si. Ggiang, gim hokchen va mui cho tan do. Diang we. Cover the vegetables. Put the pre-processed carrots in a clean jar. Pour in the cooled soaking water. Cover tightly. Leave out for about 8 to 10 hours or put in the refrigerator and use gradually after 1 to 2 days. Wishing you delicious and healthy dishes from raw carrots. Garlic, natural antibiotic of Vietnamese kitchen. Important medicinal ingredients. The main active ingredient that creates the effects and characteristic smell of garlic is allicin. Allicin. This sulfur-containing compound does not exist in intact garlic cloves. It is formed when fresh garlic is crushed, minced, sliced. Thanks to the activation of enzymes in garlic, other compounds, garlic also contains organosulfur compounds, B vitamins B1, B2, B6, vitamin C, manganese, selenium. Amazing health benefits of garlic. 1. Immunity boosting and antibacterial. Allicin is a powerful natural antibiotic that helps fight bacteria, viruses and fungi. Regular consumption of raw garlic can help prevent and reduce the severity of colds and flu. 2. Protects the heart and stabilizes blood pressure. Garlic helps lower LDL bad cholesterol levels and increases HDL good cholesterol, helps dilate blood vessels, inhibits platelet aggregation, prevents blood clots and plaque formation, thereby helping to lower blood pressure. Antioxidant 4. Prevents cancer. Garlic is a powerful antioxidant, helping to neutralize free radicals. Studies show that garlic can inhibit the growth of cancer cells, especially stomach, colon, and esophageal cancer. 5. Detoxifying heavy metals. The sulfur compounds in garlic have been shown to help the body eliminate some heavy metals from the blood. Notes when eating raw garlic to optimize benefits. 12. Eat raw. To maximize allicin, eat raw garlic crushed or chopped as high temperatures during cooking will significantly reduce the amount of this compound. Crush and wait. Crush or chop the garlic and let it sieve for about 5 to 10 minutes before eating or cooking. This time allows the enzyme to fully activate and create allicin. Dosage. For healthy people, eating 1 to 2 cloves of raw garlic per day is enough to receive the benefits. Harmful effects and who should avoid eating too much garlic or the wrong way can cause some side effects, especially for people with sensitive skin. Common side effects. Who should limit or avoid bad breath, body odor. This is a common side effect due to sulfur compounds. Digestive problems may cause heartburn, acid reflux, nausea, bloating, or diarrhea if eaten on an empty stomach. Increased risk of bleeding. Garlic has blood-thinning properties. Skin irritation. Allicin can cause irritation when in direct contact with the skin. People with eye diseases. According to Oriental medicine, garlic can irritate mucous membranes and conjunctival tissue, reducing vision. People taking anticoagulants, warfarin, aspirin, need to consult a doctor because garlic increases the risk of bleeding. People who are about to have surgery should stop eating garlic at least 2 weeks before and after surgery. People with stomach ulcers, acid reflux. Garlic can stimulate the production of stomach acid, aggravating symptoms. People with low blood pressure. Garlic has the effect of lowering blood pressure, so care should be taken to avoid lowering blood pressure too much. Onion. Allium cepa is a globally popular bulb, widely used as a spice and staple vegetable. Like garlic, onions belong to the allium family and offer a range of incredible health benefits. Onions, a universal spice and natural remedy. Onions are known for their pungent taste when raw and sweet taste when cooked, and are a rich source of beneficial plant compounds and essential micronutrients. Main nutritional components. 100 grams of raw onion contains very few calories, about 40 kilocalories, and is mainly water. Ingredients content per 100 grams of raw onion. Main health benefits. Carbs total about 9. 3 g mainly simple sugars, glucose, fructose, and fiber. Fiber about 1.7 grams, especially rich in prebiotics, fructans, which help nourish beneficial intestinal bacteria. Vitamin C, significant powerful antioxidant, supports immunity and collagen production. Vitamin B6, folate, yes, important for nerve function and metabolism. Potassium, manganese, yes, supports cell and muscle function and blood pressure regulation. Outstanding health benefits, contains a powerful antioxidant, quercetin. Quercetin is an important flavonoid compound with powerful anti-inflammatory and antioxidant properties. It helps protect cells from free radical damage. Quercetin has also been linked to lower blood pressure and a reduced risk of cardiovascular disease, improves heart health. The sulfur-containing compounds in onions can help lower bad cholesterol, LDL, and increase good cholesterol, HDL. Helps relax blood vessels and has anti-clotting properties, reducing the risk of stroke and heart attack. Digestive support. Prebiotics. Onions are an excellent source of fructans, prebiotic fiber. These feed the beneficial bacteria in your gut, helping to balance your gut microbiome and improve your immune function. Blood sugar control. Contains the mineral chromium and sulfur compounds, which may help regulate blood sugar levels and improve insulin sensitivity, which may be beneficial for people with diabetes when consumed in moderation. Cancer prevention. Organosulfur compounds and flavonoids in onions have been studied for their ability to inhibit the growth of certain types of cancer cells, such as stomach and colorectal cancer. Harmful effects and who should be aware. Despite their many benefits, onions can also cause some side effects, especially when eaten raw or in excess. Side effects who should be aware: bad breath and body odor. Because sulfur compounds are metabolized and excreted through breath and sweat, digestive problems can cause bloating, indigestion, heartburn, or aggravate acid reflux symptoms. Discomfort due to FODMAPs. Onions are rich in fructans, a type of FODMAP. People with irritable bowel syndrome, IBS, or sensitive guts should limit their intake of raw onions. Eye irritation when cut. Sulfur compounds cause burning and watery eyes. People with pink eye. According to Oriental medicine, onions are spicy and hot, which can make eye disease worse. People with kidney disease. Onions contain phosphorus, although less than some other vegetables. People with kidney disease should eat cooked onions, reducing the amount of minerals, and limit eating raw onions to reduce the metabolic burden. People with low blood pressure. Onions have the effect of lowering blood pressure, so be careful to avoid excessive blood pressure reduction. Tips to reduce the pungent smell of raw onions. To eat raw onions more deliciously and reduce the pungent smell. Cooling. Put the onion in the refrigerator before cutting, soaking in water. After slicing thinly, soak the onion in ice-cold water or water mixed with a little vinegar for about 15 to 30 minutes. This helps to remove some of the sulfur compounds that cause the pungent smell. Corn or maize is a popular whole grain, providing many important nutritional and health benefits. Corn, a versatile whole grain. Corn is an excellent source of energy and fiber, and is used in many different dishes around the world. Main nutritional facts. Corn boiled sweet corn. 100 grams has about 86 calories and contains the following outstanding nutrients. Ingredients content opening parenthesis APPR laxstock closing parenthesis main health benefits carbohydrate 18.7 grams main source of energy, mainly starch. Fiber to 2.7 grams helps digestion, creates a feeling of fullness for a long time, prevents constipation. Protein 3.7 grams, builds and repairs body tissue. Vitamin B1 thiamine high important for nerve function, supports memory. Folate B9 high essential for blood cell formation and important for pregnant women. High in lutein and zeaxanthin antioxidants important for eye health. Outstanding health benefits boost eye health. Corn contains high levels of lutein and zeaxanthin to carotenoids that make up a large part of the macular region of the eye's retina. They act as antioxidants, helping to filter harmful blue light and reduce the risk of age-related macular degeneration and cataracts. Good for the heart. Corn oil contains beneficial unsaturated fatty acids omega-3 and omega-6. Helps reduce bad cholesterol LDL, thereby reducing the risk of atherosclerosis and cardiovascular diseases. Supports digestion and weight loss. The high insoluble fiber content in corn helps promote regular bowel movements and prevent constipation. Fiber helps you feel fuller for longer, helps control your calorie intake, and is beneficial for weight loss if eaten in moderation and appropriately. Prevents anemia. Corn is a source of iron, vitamin B12, and folic acid folate, all of which are essential for blood production, helping to prevent anemia. Diuretic and cooling effects. In traditional medicine, boiled corn water, especially corn silk, is used to cool, detoxify and support urination. Corn and weight loss. Can support weight loss because corn is a whole grain rich in fiber and has a moderate amount of calories. When boiled, it helps create a feeling of fullness for a long time. Limit snacking, thereby supporting weight control. Note: corn still contains starch carbohydrate, so you should not completely replace rice with corn, and you need to control the total amount of corn you eat each day to avoid taking in too many calories. Waxy corn usually has a higher fiber content than sweet corn, so it can be preferred in a diet. Harmful effects and who should be aware of difficulty digesting. Corn hulls contain cellulose, a type of fiber that the human body does not have the enzyme to fully digest, which can cause indigestion and bloating if eaten too much. Difficult for diabetics. Although corn has a medium glycemic index, if eaten in large quantities, the high carbohydrate content can cause blood sugar to rise rapidly. Diabetics need to strictly control their intake. Upset stomach. High fiber content can cause discomfort and bloating in people with stomach problems or sensitive digestion. Increased risk of allergies. A small number of people may be allergic to the protein in corn. Asparagus is a premium vegetable, known as the king of vegetables because of its high nutritional value and many health benefits. Asparagus, the nutritious king of vegetables. Asparagus is a delicately flavored herbaceous vegetable, highly valued in culinary and nutritional circles for its rich vitamin, mineral and fiber content, while being very low in calories and fat. Key nutrition facts: asparagus is very low in calories. A 3-ounce serving of cooked asparagus contains just 20 calories and has the following key nutritional facts. Ingredients amount per 3 ounces cooked. Key health benefits: vitamin K very high, 57% RDI. Necessary for blood clotting and bone health. Folate vitamin B9 high, 34% RDI, important for DNA formation, cell division, and especially good for pregnant women. Vitamins A and C significant powerful antioxidants, support immunity, vision and collagen synthesis. Fiber 1.8 grams aids digestion, promotes satiety, and contains prebiotics. Protein 2.2 grams provides a good amount of protein compared to other vegetables. Outstanding health benefits: supports weight loss and weight control. Asparagus is very low in calories and fat, but rich in fiber and water, which helps increase satiety and curb cravings. Contains the amino acid asparagine, which acts as a natural diuretic, helping to eliminate excess fluid, reducing bloating and edema, improves digestive health. A source of prebiotic fiber, soluble fiber that helps nourish beneficial bacteria in the gut, supporting a healthy microbiome and improving nutrient absorption. Antioxidant and anti-aging. Asparagus, especially purple asparagus, contains many powerful antioxidants such as anthocyanin, glutathione and vitamin E, C, which help protect cells from free radical damage, slowing down the skin aging process. Good for the heart and blood. Rich in folate and vitamin B, which helps regulate the hormone homocysteine. High concentrations can be harmful to the heart. Abundant vitamin K helps strengthen bone and joint health. Notes and subjects to limit. Asparagus is safe for most people, but some subjects need to note. Subjects note. Reason: people with gout. Asparagus is in the group of foods with high purine content, over 150 milligrams, 100 grams. Purine is converted into uric acid, which can increase uric acid concentration in the blood and cause acute gout pain. Should be avoided or limited as much as possible. People with heart failure, kidney failure, edema. Because asparagus has strong diuretic properties, it can cause complications or electrolyte imbalance in people with kidney, heart dysfunction. Should consult a doctor. People taking blood pressure medication. Because asparagus has the effect of regulating and reducing blood pressure, it can interact with the blood pressure medication being used, causing a sudden drop in blood pressure. Be careful and consult your doctor. People with allergies. Some people who are allergic to vegetables in the Liliaceae family, such as leeks, chives, celery, may also be at risk of being allergic to asparagus. Tips: smelly urine. After eating asparagus, urine often has a characteristic odor due to the decomposition of asparagusic acid. This is completely normal and harmless. Preparation: do not overcook asparagus because it will lose many important vitamins and minerals. Tomatoes are a very popular fruit and a treasure trove of great nutrition. They are widely used in cuisine and bring many significant health benefits. Tomatoes, treasure trove of lycopene. Tomatoes are a berry, rich in water about 95%, and have a very low calorie content. Main nutritional components: 100 grams of raw tomatoes usually contains only about 18 kcal and has the following outstanding nutritional components. Ingredients content per 100 grams. Main health benefits: water about 95% hydrates the body. Carb 3.9 grams, mainly simple sugars, glucose, fructose. Fiber 1.2 grams aids digestion. Vitamin C high, strong antioxidant, boosts immunity, helps absorb iron. Potassium significant essential mineral, helps control blood pressure, good for the heart. Vitamin K1 important essential for blood clotting and bone health. Lycopene very high red pigment, the most powerful antioxidant in tomatoes. Lycopene, the star of tomatoes. Lycopene is the red pigment of tomatoes and is an antioxidant in the carotenoid group. Characteristics: lycopene is better absorbed when tomatoes are cooked with a little fat, for example olive oil. This makes tomato soups and sauces more nutritious than raw tomatoes. Outstanding health benefits: heart protection. Lycopene helps lower LDL bad cholesterol and blood pressure. Potassium, vitamin B and folate support blood vessel function and prevent heart disease. Cancer prevention. Lycopene is an antioxidant that has been extensively studied for its ability to reduce the risk of certain cancers, especially prostate, stomach, and colon cancer. Improve vision and eye health, rich in vitamin A and antioxidants like lutein and zeaxanthin, which help protect the eyes from sun damage and reduce the risk of macular degeneration. Skin beauty and anti-aging. Vitamin C helps stimulate collagen production, making the skin firmer. Lycopene protects the skin from UV rays, but cannot replace sunscreen. Note: important when eating tomatoes, do not eat when hungry. Pectin and phenolic resin in tomatoes can react with stomach acid, easily causing stomach cramps, stomach pain, nausea. People with reflux, stomach pain. Tomatoes or acidic contain malic acid and citric acid, which can stimulate the stomach to produce more acid, aggravating symptoms of heartburn and acid reflux. Should limit eating raw. People with kidney stones, kidney problems. Tomatoes contain oxalate, which can accumulate and contribute to kidney stones if consumed in excess. Do not eat green tomatoes. Green tomatoes contain high levels of the toxic alkaloid solanine, which can cause food poisoning, nausea, vomiting, weakness. This substance gradually decreases and disappears when the tomatoes are red and ripe. Eat in moderation. Eating too much, more than 1 to 2 large tomatoes a day, can cause lycopene accumulation, causing the skin to turn orange like apenodermia, a harmless condition that needs to be controlled. Dear friends, after age 60, the body changes, kidneys filter slower, blood vessels become more fragile, and hydration needs change. Even healthy foods can work differently. Timing, dosage, and drug interactions are key. The video encourages awareness, balance, and consulting a doctor before making dietary changes, so you have understood the secret about seemingly harmless vegetables that pose a high risk of stroke and blood clotting. Knowledge is the key to protecting your health. If you find this video useful and help you better understand how to eat safely, do not hesitate to click the subscribe button and the bell icon next to it. This helps the channel 70 Lasting Health have more motivation to continue sharing important, scientific and free health knowledge to the community. Please comment below sharing which vegetables you stopped eating after watching the video, or ask questions if you have any. And most importantly, share this video with your family, friends, especially the elderly you love, because this knowledge can save their lives. Thank you for joining 70 Lasting Health. See you in the next health videos.